So, good day, everyone, and welcome to our webinar, which is called AI for Every Clinic, Every Doctor, and Every Device. And my name is Yana, and I will be your host for today's event. So, Philippe, the floor is yours. You're welcome to start.
Okay, thank you very much for the invitation, and I'm really excited about that event. Of course, because of the topic, but also because of some friends in the call. So I'm happy to share the stage, with my friends here. So first, in terms of AI achievements, I listed a few. Of course, there are much more, but I think that's already enough for the few minutes that are allocated. So I think the first point is advancement in predictive analytics. So AI algorithms can analyze large data sets to predict health outcomes. So the benefit includes early detection and prevention strategy. So for example, it can analyze patient records, but also link it, for example, to lifestyle and, what you eat, where you live and all that. And there are, for example, programs, I just, that there are few programs, but for example, I can give one example, is a program from the Novartis Foundation called Cardio for City, for example, which is analyzing the data where you live and all that and the impact, on cardio diseases. Second point is drug discovery and development. I think we have a lot of discussion and things are happening. A lot of things are happening there, but of course we expect much more to happen also. But there are companies, like for example, a company called Benevolent AI from the UK, who is identifying the new therapeutic modules and accelerating, the initial stage of drug development, because I think, in the old way, it takes years, the whole drug development process is very lengthy. And also there's a lot of waste in the process, sometimes it's also about recognizing early that you're not going to get there, and then you spend money, which you might have to spend to get out of the next successful drug development. Next point is personalized medicine. So of course we have more and more data, patient data, again, as mentioned before, also including lifestyle, environment, genetics, and bringing all this data together, thanks to AI, can give you some specific personalized treatments insights, because we all know that we are different, we know it when we eat something, not everybody has the same allergy or react in the same way, or even taking weight or not taking weight when they eat something. So we know that our bodies are very different, and with these insights and the vast amount of data that AI can basically work with, we can find, some insights. And again, as an example, there's a foundation medicine, I think from Roche, who is doing that kind of stuff, around oncology, around cancer, to get a better personalized treatment for oncology, for cancer. Then, of course, there are enhancement in telemedicine. I think a lot happened during COVID. But again, there are many solutions of telemedicine. That they are smaller ones, bigger ones, different scale, a country level. But for example, there is one called Teladoc Health, which is used in more than 130 countries. So I'm just saying, all this data, and then it's also used, with virtual health consultation. We know that we have a big shortages in healthcare professionals, in doctors and all that. So what can be done by AI is not a competition for me to the doctors, is, helping them, to get more of their valuable time where they should use it, when they are patients that really need that. Then robotic surgery and automation. I think there's also a lot there, so the whole robotic surgery is a whole space in itself, where really it's also about precision, sorry to say that, nothing, I have a huge respect from all the surgeons and I have a lot of them around me. But at the end, they are humans. And when you look sometimes the hours they are doing, hours of surgery and all that, you get tired. I don't think, your hands and the brain and everything is functioning the same way when you are tired. A robot by definition is not getting tired. So the robot will do 100, 200 times the same, exactly the same precision intervention, and that could also help in terms of recovery for the patient, because there will be less mistakes or more exact intervention. But of course, there are also challenges and issues, for healthcare. So I think the first one is also the one we talked the most about it, is data privacy and security. So of course we talk about patient data, and it's not just patient data like today. The whole set of patient data becomes bigger. So by becoming bigger, there's also more risk, different data, so we have to be sure, about, all these data breaches, unauthorized access, misuse of sensitive health data. So I think data privacy and security is a key challenge. Then again, bias and inequality. I think we have heard a lot about that, and unfortunately, I would say bias is not really coming from AI. The bias is something we have already created, we as human, but we are just amplifying it because, we are training the AI with biased data. So I think we have to be careful about that, and again, it's things like, when you do, you have AI models with mainly Caucasian population, of course, that's biased against the other population, and you have a lot of examples already out there. Next one is regulatory and ethical issues. So again, the whole regulatory landscape, and I'm also an advisor, a board member for a company called AI 2030 in the US. The whole issue is we are aware, but it's still difficult to adapt the regulatory landscape, to this new model, because we were used to take time to have approvals, FDA approved and all that stuff. But today, during the time that you make these approvals, there's already a new version, something changing. So we have to learn, to be more iterative on the, continuous changes, to be more flexible, because the time is gone, that you can define something and it's valid for 5, 10, 15, 20 years. So we have to find another way also in terms of regulatory and ethical issues, again, is also the same because of the amount of data, the speed of the changes, ethical considerations are becoming key. Then interoperability and integration, that's still an old story, but it's still out there, AI can do a lot, but we still have many different systems that are not talking to each other. If you take example even of electronic health record, everybody talks about that, but where is this, where do we have this EHR record that we can use even not within a country, but think about across countries. I'm living at the border with Germany, Switzerland, and I'm living in France. I can tell you, there is nothing like that happening. I can go to the doctor in Switzerland. He's not connected at all to the system in France, and they have no idea about my record. So, this interoperability and integration is still on the table. There are some progress, but there's still a lot to be done. Then, of course, skill gap and adoption resistance, so it's still, we still don't have enough skilled people, in AI and especially AI in healthcare. And I guess Harvey will also talk about that, because we have to embrace it, but at the same time, how you get all these doctors on board while they are so busy, and have no time for this whole upskilling and all that. So it's a chicken egg story, sometimes somewhere we have to free up time so that they have time, to get upskilled, and then there's still the resistance, not everybody in healthcare is embracing, AI, and, they prefer the old way they have learned at school. They feel more confident with, what they have learned for years at school than trying something new, which they may be afraid of. So what can AI do? So I think AI is quite good in pattern recognition. So it's really analyzing a big set of data, complex data sets, and finding some insights that we with our human brain may take much more time, to get this kind of insights. We can take example, of image analysis. So the whole radiography is not really a new space. We have AI solutions out there since years. The problem is always how you get that in every single hospital, near you. Then also genomics, the genomics is a big topic depending, it's very different from one country to the other. For me, for example, I'm quite often in the Middle East. So genomics is a huge topic in the Middle East. I'm just coming back from Abu Dhabi, where that they invest a lot of money and are, for example, training 600 students, on genomics. So again, AI can help a lot, in understanding this genomic data. Same about predicting disease outbreaks. Like I think COVID was not the best example, but we learned a lot during COVID. Then the second one is natural language processing. There are huge progress done, in this whole natural language processing, and really it's also a big help, for doctors where basically they can use this kind of dictaphone or whatever on a much better way, and I've recently experienced a solution from the UK where basically I was really having a chat with the doctor, for 15 minutes, what is not really happening often. And there was just an AI preparing the whole report and everything, and it corrected some of my even issues related to my accent or whatever. Huh? Then, of course, the whole decision-making, so AI can support clinical decision-making and provide evidence-based recommendation based on, on all this data. Again, it's a lot happening for example, in the radiologist area. Then automation of repetitive tasks. I think that's a very important one for me because that's, again, in my aim to try to release some of the time of the doctors. So sometimes it's not always about the complex tasks, like the whole new drugs or whatever, but simple tasks that are consuming a lot of time, of non-added value time for for healthcare professionals. That's also where AI can do a lot, taking appointments, sending reminders and insurance claims and all that kind of stuff. Then enhancing creativity. And I think it's important to mention enhancing creativity because we will come to the point what AI cannot do. So of course, AI can provide some insights about innovative solution for complex problem, but not really creativity in itself. It's just enhancing. And for example, a company I know quite well because I know the CEOs in silico medicine, it's using AI to identify new drug candidates, so really seeing new insights that maybe we would not see. So what AI can't do, so emotional intelligence. So I think really that's something, where and I'm even not sure if you want AI to do that, but really, for example, if a patient is facing serious issues, it happened to me recently to have a patient next to me where the doctor had to announce that he has cancer. Do you want AI to make such an announcement, or do you need some emotional, a human telling that, So I think that's one example. General intelligence, again, we know, we don't want to talk too much about it. We're going to that direction, but we are far from being there. So it's really, AI is designed to perform specific tasks, but the general intelligence to adapt to a wide range of activities is not there. For example, an AI can be trained to analyze medical images, like we said, but the same AI cannot do financial forecasting. So really, it's really in silos, you can specialize in one area, but across different areas is going to be challenging. So creativity and innovation, as I said before, as long as in one area, it can provide you ideas, but an innovation across different concepts, combination and all that is going to be difficult. So it's really, creativity and innovation come often for something else, not just in a silo. It's not just about data. Ethical judgment, as I said, that's very important. So again, you can train AI, but the ethical piece is really something which is, take an example, an end-of-life decision. Again, is something, happening in the hospitals, people having cancer and all that. So end-of-life decision, I don't think you can give that, to an AI to take such kind of decision. Then again, as I mentioned already, adoption outside of training. AI is very good, in the area you train them, but across, left or right of that space that you have trained AI is going to be difficult and challenging. And then again, understanding contents and common sense. So these are really the strengths of the human. For the moment, AI doesn't have a common sense. It's just a machine that is learning something and can do it quicker, faster than we do. But there is no understanding context and common sense. So what is holding healthcare back? Again, regulatory and compliance challenges, as mentioned already before, so it's really a different world. Resistance to change, as I mentioned already, being, from doctors, from patients, so we still have a huge resistance to change. Then technological limitation and integration issue, as already mentioned, I'm just repeating some of the points that were before: data privacy, security concerns. Then economic and financial constraints. We know that our healthcare system is sick in many countries. We don't have enough budget. We don't have enough money. So how are you going to invest, to spend even more until you get really the return of investment? So I think that's really holding a lot of, as I said, for example, radiology, the solutions exist, but why are they not in every single hospitals? And then the workforce issue. So the workforce issue is twofolded, I would say. And on one side is getting the AI skills into the healthcare. So getting, even if you start to train the people at school, it's going to take time before they are really also doctors, So it's one side. But again, don't forget also the patient side. It's not just about educating the healthcare professionals, but the patient have also to understand what is happening and what is going there.
Well, good morning, good afternoon, good evening to everyone who joined our webinar today. I'm truly honored to participate in such an amazing event with highly esteemed speakers like Philippe and Harvey, and speak about AI medical devices. Once prioritizing disease treatment, healthcare is now primarily focused on disease prevention. As we all know, this requires constant monitoring of patients' health and effective management of patient data, from EHR data to information gathered from wearables. Consequently, the volume of data is increasing rapidly, which in turn leads to adoption of various digital tools, including but not limited to data management systems, artificial intelligence, robotics, the Internet of Things, and many more by hospitals and clinics. All this has brought to life the concept of a smart hospital. In my today's page, I'll address the intersection of contemporary health data management, AI tools, and compliance, all of the above within the context of a smart hospital. These state-of-the-art medical facilities have been largely covered by different authors, both in scholarly papers and mass media, but what's surprising, up to date, there's no universally accepted definition of smart hospitals. McKinsey Health pays special attention to digitalization of all information, excellent interoperability of the systems, and stable core infrastructure. So it's clear that the transition from a good hospital to a smart one is quite a complex task. The infrastructure must be built and maintained. AI solutions and other digital tools must be implemented thoroughly and smoothly. Patient safety must be ensured, definitely, and hospital staff trained. And Philip mentioned that a couple of times. The 7 stages of EMR adoption developed by Haynes perfectly illustrate the complexities of transitioning from a good hospital to a smart one. Like I said, the EMR is just one component of its entire system. Such tech maturity demands the engagement of tech experts, which is why many smart hospitals would employ numerous tech personnel. And for instance, we all probably know Charité, one of Europe's largest university hospitals. it employs approximately 1,200 specialists in administration and management. This is about 5.5% of the entire staff. Many of them are directly involved in making this hospital smart. If we look at the architecture of a smart hospital illustrated by Pavel Belay, thanks to him, we see that a vital part of a smart hospital is a data platform with data lake, which enables constant data ingestion, processing, and analytics. Of course, AI is heavily used in forms of machine learning, deep learning, computer vision, speech recognition, and natural language processing for enhanced data analysis, for predictive modeling, intelligent decision support. Usually, most data engineers, AI scientists, DevOps, and system administrators would be involved in this job internally. But for example, remote patient monitoring, system integration, clinical communication, and many more other tasks could be and actually are outsourced to external vendors, even the most successful hospital systems, which have their own baked innovation teams, like Providence House, for example. External specialists can facilitate continuous accessible care beyond the hospital walls, and this is particularly important for chronic and elderly care. However, these external vendors should be experienced in delivering custom healthcare software, including software as a medical device, cloud services, and healthcare usability. Except for technological and management complexities, there are also a number of regulatory issues to consider. This is of special importance, I would say, for hospital administrators and SMD developers. So when we speak about hospital administrators, a smart clinic is a complex system that constantly processes vast amounts of patient data with AI. The important compliance consideration for hospital administrators is obtaining explicit patient consent for using their identified health data in AI training, in AI research, going beyond standard HIPAA consent requirements. It is necessary to set up procedures and processes to ensure that patients are fully aware of how their data is used and managed in smart modules. They should be able to withdraw consent to use their data. At the time, many healthcare stakeholders and researchers consider that data donation is crucial for further development of AI tools, which could be very beneficial for medical practice and people's health. Securing fairness and minimizing or completely cutting bias in AI-generated care recommendations are also vital. What's more, specialists working on regulatory frameworks must clearly define liability for cases when AI-driven recommendations conflict with clinician judgment. As for the clinicians, I think that they should be involved in a smart hospital implementation from the very start. Their expertise and first-hand knowledge of clinical needs and processes are vital. They must take part in developing the concept of an AI solution as well as its validation and testing. They can also take part in activities related to market analysis and some assessments of applicability of digital products to individual cases. If we speak about biomedical labs require strict adherence to industry standards and laws. To ensure compliance, labs must implement robust data validation mechanisms with their laboratory information systems. User authentication, data encryption, and access controls are crucial for protecting sensitive patient information under HIPAA regulations. The interoperability of LIS allows seamless integration with laboratory instruments and systems, mainly EMR. Comprehensive quality control measures, including detailed audit trails and their documentation, reinforce the lab's commitment to quality assurance and regulatory compliance. That said, a well-designed and well-connected LIS helps biomedical labs achieve data accuracy, patient safety, and compliance with regulations. When it comes to wearables, it becomes a more advanced integrated part of remote patient monitoring. the risk class of a medical device, as we all know, increases with the complexity of connected wearable. A robust regulatory framework and enhanced control are in this case indispensable. Features in wearables which are certified as software as medical devices are subject of relevant approvals to assess their safety, efficiency, compliance with regulations from FDA and other authorities. This includes classifying the devices based on their intended use and risk level, and following appropriate approval pathways such as pre-market notifications, pre-market approval. In this case, the integrity of health information is possible only with secure, reliable, and accurate data transfer. So the protocols by which data is obtained from wearable devices and integrated into medical systems must be also regulated. I'm, as a representative of IT experts, can say that we should prioritize interoperability and data accuracy with standardized data formats and communication protocols. Once approved, wearable medical devices and their integration with other systems must be continuously monitored and evaluated for any changes or updates. And afterwards, if any happen, make some revelations and pre-approvals by regulatory authorities. Finally, medical devices are also subject to strict regulation. However, as hospitals acquire certified products, certification issues are more relevant for S&D developers. It is the software development companies, which is important, not hospitals, that bear the responsibility for recertification and implementing any necessary changes to digital solutions. It is necessary to additionally outline that the development process strictly adheres to regulatory requirements like FDA, MDR. This is why the DevOps process, the DevOps area, falls under the umbrella of regulation. Every deployment involves a series of steps like maintaining a medical device file, documented release changes, reviewing the release policy, and adhering to all compliance processes, etc. This is one more important thing to consider. Smart algorithms are constantly evolving, which does not easily align with actual regulatory frameworks. They may change over time and substantially between the time of their initial approval and subsequent iterations, posing various challenges for maintaining compliance. IT providers in this case need an efficient strategy for AI implementation in medical devices. Based on Andersen's extensive expertise in delivering healthcare solutions, if you allow me, I would share some, I would say, insights that could assist you implement AI in medical device. Our company has relevant certifications and procedures so we can assist medical organizations in delivering and certifying such solutions. So first and foremost, make sure your team includes healthcare professionals, AI developers, regulatory experts, and domain specialists. So with this all, you secure a comprehensive understanding of both healthcare needs and regulatory requirements. Then begin with a detailed analysis of healthcare processes, user requirements, regulatory standards for a solid foundation for development. After that, make compliance with regulations such as HIPAA a top priority for the projects from the project's beginning, from the project start. Or even double check if all aspects of AI development and implementation adhere to legal and ethical standards. After that, maintain open communication channels with regulatory bodies, healthcare providers, and industry experts to stay informed about evolving regulations and best practices. Integrate strong security protocols to safeguard sensitive health data throughout the AI development process, from collection to processing it and storing. Involve healthcare professionals and end users in development process to get the feedback and ensure that these AI-powered medical device meet the needs while remaining compliant. Then conduct thorough testing, validation, and verification process. offer training programs for healthcare professionals to familiarize them with AI technologies, the implications for patient privacy, and best practices for compliant usage. Keep detailed records of the AI development process, including documentation of regulatory compliance efforts to facilitate audits and demonstrate adherence to standards. And last but not least, continuously monitor AI systems post-deployment for any compliance issues or security vulnerabilities. And if any, promptly address them via updates and improvements. We believe that by following this action plan, you can navigate the complexities of integrating AI into medical devices and still ensure compliance with regulatory standards. As you can see, there are multiple challenges of creating a smart hospital, but also with that all, it presents remarkable opportunities for healthcare, for medical professionals and IT experts. Such healthcare facilities will definitely provide better medical care to patients. I believe it will. And Andersen, as a healthcare software development company, is on our mission to deliver these credible solutions for smart hospitals and or helping medical organizations build smarter ecosystems.
All right. So welcome, everyone. Thank you for coming. It's an honor to be here and share this amazing stage with all these amazing other speakers. And thank you, Andersen, for creating this. So as we know, AI is growing so quickly. We have all these smart products. There's just so much coming at us so quickly. No one in the world can say they know it all because it changes. And even if they could, it changes literally that same day. There's so many smart products out there. This is the Meta glasses. I can put them on and I can put AI on these and I can literally take pictures of you right now. And I just did. And then I can ask ChatGPT questions. So as you're asking me questions, if I have these on, it can interpret and have them on here, put them in my ear, tell me what I need to say back and say it back to you. So this is just one quick example of how AI is changing. This thing also will take pictures. So when I take a picture, I can be like, how much is that computer screen? Or tell me about that EKG, and it'll process. So this is where we're at. I'm just going to start off with a couple of props just to kind of give you a quick example. This is the rabbit. This is a 3D model. But again, it does the same thing. Say I'm coding a patient and I know that I need the cath lab here to, because they have heart blockage. I can literally say code heart attack, and then it would literally text everybody that needs to know, have the image of the EKG, send it to that people and activate the lab. And all I had to do was press this button. Obviously apps are like that and that exists. Other things that are on there, Philip and I love VR, having this device, incorporating this into medicine, it's going to change things. And so I just wanted to give you a quick intro before we jump into the slides. I always show this little plushie, but we've developed information where I can program this with ChatGPT. And if I'm a child and I want to go over certain medical conditions, or maybe I need to go through an MRI and it's a really scary effect, I can program this so I can have a conversation about the MRI and that experience as a child. So I just kind of want to open your eyes to just the different technologies out there. I'm wearing the Humane AI pin. I can translate with this thing. I can do the same things that I just showed you. So as we start looking at where are we in AI in healthcare, I mean, this thing is from A to Z. It's the bell curve. As we notice, there's so many people out there that are scared of AI, and I totally understand that. But let's look at the positive. Let's focus on how can I make AI better for my patients, better for my healthcare institute. And so we know that AI is no longer a novelty. AI is here to stay. And administration in our healthcare systems are starting to use it to make better decisions. It's helping us support our clinical decisions. And as we move forward, I'm really excited to be able to see how we're able to capture these predictive analytics and personalizing our healthcare. Understanding how the other day I was meeting with a friend of mine, and he's a surgeon, and he developed this robot. And he was telling me, yeah, I'm working on using AI so that when I come into the operating room, depending on my NFC, it will tell the nurses and everything what tools are needed, what instruments are needed, and automatically they can change that room. How exciting that we're able to do this. We know that recent surveys show that about 60% of healthcare institutes have adopted some form of AI. And it's only going to get to about 80%. And I know the first thing 80% in the next 2 years. And I know the first thing I thought of is, how much AI are they using? And so in that study, it can maybe be something very simple as, I'm calling the hospital to get an appointment, and AI is interpreting and integrating my calendar so that I can get that appointment when I need it. Instead of having to speak to a human, AI is able to give me that access that I need with my healthcare professional. The impact of healthcare delivery, you can see it all over. We're seeing it in our outcomes. We're seeing it as reducing our costs. We're seeing the efficiencies of AI. And so as we start enhancing patient care, I mean, this is just huge. I mean, the ability, I'm in Dallas, Texas, and people all over the world are listening to this. The ability for me to speak to you using AI, customize the way I speak. If you speak another language, I could use AI to speak your language. And in real time, I can talk to you and take care of you in your country and the way you speak and your customs. And I can use AI not just to give an example, but I can give examples specific to your country, to your culture, to your sex. I mean, how amazing. What an impact as a doctor can I have on you to be able to do that? And so if I can create better diagnosis, better personalized treatment plans for you, better predictive analytics, I will have better outcomes. Simple, quick example. I have a child, 5 years old. I'm seeing him. The first time this kid has asthma. If I can create a coloring book and sit with my child and say, hey, buddy, you have asthma and this is your disease, and let's color together. And I can, through that coloring book, explain how to take his inhaler, how to prevent asthma, how to take care of himself. I am reaching out. I am giving him the best outcome. And these are the tools that AI will do that. And I'm so excited. And as I move forward, I look at the streamlining operations here that the slide says. It says clinical harness AI operation task and reducing those administrative burdens. Imagine if I am able to reduce my errors and increase my efficiency. Case in point, I'm an ER doctor. It's 3 a.m. I am exhausted. I'm a human being. I'm trying to be my best, but guess what? I'm a human. I can drink all the coffee in the world. I could do my best, but I'm still human. But what if I said I have AI? And not that I'm an idiot, not that I'm stupid, but then I take your symptoms, I put them into AI and I go through it together. And then the AI, it's like, hey, I noticed that you didn't look at the patient's ears. And I'm like, oh crap, you're right. Let me go back and check out the patient's ears. And I'm like, you know what? I did find something. So this is how I say it's AI plus human. It's always going to be better than just AI or just human. And that's what we need to get to. Whatever you're doing, whatever you're working, keep that in mind. And so as I'm reducing costs and allocating these different things, I'm using AI to really cut healthcare costs rather. And when I do that, some people are going to say, look, Harvey, this is going to increase our costs. And I'm going to say to you, it depends who's creating those applications. It depends who the administration is, and it depends how it's going to be done. But in my goal, in my heart, my goal is to create products to make sure that this is really reducing costs and helping us. And so some of the studies out there are showing that AI is reducing wait times by 30%. And when I look at that, that makes me excited because as an ER doctor, I mean, how many times have I had patients wait in the waiting room? And I hate it. But if I had an instrument that helps reduce that wait time, increase access to you, man, what a win. You know, I see studies and I open a newspaper and I read about people dying in the emergency room. And I'm like, this is not right. We need to do something to make a change. And that change to me is AI. You know, quick story. I'm really passionate about this. I wrote the first book on ChatGPT and healthcare back in 2022. And it wasn't about profit. It wasn't about getting famous. It was just to give a message to help create better service for our patients. And so when I see these kind of studies and I see people dying in the emergency room, I'm like, no, we need to use something. And that something is AI. And so increase accuracy when it comes to detecting cancer. This is a personal note for me. My mother had cancer and it devastated me. Thank God she's alive, she's well, but catching these things, catching it early, we're in a sick care society, but if we can change it to be a preventative medicine, if I can look at my iWatch and my iWatch is detecting and saying, hey, Harvey, your HRV is low, we need to work on it. You need to sleep more. You're not sleeping. You're pre-diabetic. We're starting to see it. Believe it or not, many people don't know this, but this conversation we're having, this stream, I could take the stream and it would say, you know what, Harvey, you're pre-diabetic. Your voice, we can tell that your sugar is high. And so if I can capture these things and prevent things, oh my gosh, what an amazing thing. I can help it. I can save a life. And so early disease detection is huge. Alzheimer's is AI can detect Alzheimer's, believe it or not. Again, this voice that I'm coming through, if I connect it to an algorithm, it'll say, you know what? Harvey's getting Alzheimer's. Harvey's getting Parkinson's. Harvey's getting diabetes. Just with this voice. Amazing. And so if I can use this to predict before you get there, and I can start preventing the disease, or let's say there is no cure for the disease, but I can extend your life by 6 months, a year, 5 years. Man, amazing. That gives you time to be with our loved ones. So to me, I'm really passionate about this. When I look at this, and there's some case studies that show Morgan Sloan Kettering Cancer Center is having pathologists detect cancer with a 95% accuracy rate. And I'm thinking, why isn't the rest of the world using this technology in pathology? It's already digitized. They already have the information. Why aren't we leveraging these tools to help our patients? The next one is radiology revolution. Oh my gosh, this is huge. Excuse me. If I can detect, and this says AI is now a stable radiology department, reducing scans by as much as 50% in detecting abnormalities. And let me give you a case in point. One of my friends, I'm kind of jealous. His hospital has this detection system where if someone comes in with stroke-like symptoms, they run through the CAT scan, but this is what AI does. It reads the CAT scan. In real time, the AI is going through and saying, hey, this person has a stroke. This person's bleeding in their head. And what does it do? It sends it directly to the radiologist. And the radiologist is like, oh my gosh, I need to read this now because this is possibly a stroke. It sends me, the ER doctor, my friend actually, a text saying, hey, their patient's having a stroke. And now I can jump on this and start getting the room ready, calling the people that need to be. And if those seconds count to save that life, amazing. That to me should be the new standard of care. And so the predictive analytics is huge again. Imagine a hospital administrator knowing that something is going on. Imagine where, for example, if there's an outbreak and I'm in the emergency room and say I'm in Dallas, throughout Dallas, Texas, people are having salmonella poisoning because bad lettuce went out and all these people are having diarrhea. But I'm not talking to the hospital across the street. I'm not talking to the hospital down the road. But if AI is talking to each other and being like, hey, we're seeing cases of diarrhea, and all of a sudden we're seeing a bunch of them, guess what? We can all collectively say, you know what? Maybe it's the restaurant. And then now, before it becomes a huge outbreak, we can go call those restaurants and say, hey, it's your lettuce. Let's call the manufacturer. Let's see where the source is. Now we can prevent. Now we can save lives. Let's talk about COVID, preventing the outbreak. Same example. We have algorithms that can detect these things. Man, amazing. And if we can incorporate that into our EMR and in real time, man, this is huge. When the flu hits every year, I always go on Google to see where in the world the flu is the worst and what zip code is getting worse. And then when it starts getting closer and closer, I'm like, all right, it's time for me to get my vaccine and it's time for me to be ready because it's coming. Imagine having those preventive administration tools, being able to reduce admissions and reduce readmissions, meaning if I'm about to send you home and in my clinical gestalt, I've been doing ER for 20 years and be able to say, you know what, I'm going to send you home. But then if the AI is saying, wait a second, based on the parameters of this patient, blah, 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 did you consider this factor when sending the patient home? And now the human in the loop is me and saying, you know what, I did not account for that. I think this patient should stay another day or two so that we can correct that one variable. Imagine how much of an impact that would have with our patient.